Thank you so much. Okay, welcome everyone to the 2024 Cloud and Big Shots of Arizona Awards Q&A session. We are so happy that you're here. We're excited to start off this year with the Cloud and Big Shots Awards. It's our award season at TAPI, and we are so happy that you're here and hoping to answer any questions that you may have. As a reminder, if you could please keep yourself on mute unless asking a question. We will have time at the end to ask questions. And then make sure that if you feel like turning on your camera so everyone can see each other, feel free to do that. And I think that is it. So let's get started. So TAPI has two different award categories. We have the Daniel T. Cloud Outstanding Practice Award, and this is an assessment-based award that recognizes all of the great efforts that the practices are putting into keeping all of their patients immunized and healthy. We know that that takes a lot of work. There is a lot of steps that go into that. Not only giving the actual vaccine, but recording them correctly and running reports and all of that. So this award is well deserved to those practices who reach 90% or more coverage of their patients. We also have the Big Shots of Arizona Award. This is not assessment-based. It is for organizations and individuals who have distinguished themselves by improving the health and wellness of Arizona communities through many different ways. So those are our two awards, and we refer to them a lot as the Cloud Awards or the Big Shots Awards. Like I said, the Cloud Award is assessment-based, and how you qualify for this is running a report in ASIIS for specific age categories. And we're going to learn a little bit more about that process. So we have an expert from the State Health Department here to talk to us about what that report looks like, how to run the report, and then Pilar, thank you so much for joining us. And then we have Eileen in the chat as well, ready to answer any ASIIS specific questions. So feel free to go ahead and use the chat box. And Pilar, go ahead if you would like to start sharing your screen.
Okay. Hi everyone, my name is Pilar, as I mentioned. I'm basically going to show you guys how to run some different reports in ASIIS to help you guys maintain some really accurate data and use these reports to the best of your ability, especially moving into Cloud Award season. So let me go ahead and share my screen, and just please let me know if there's any issues with viewing this. Okay, is everybody able to see my screen?
We're good.
Perfect. All right, so the first thing I'm going to show you guys how to do is how to inactivate patients in ASIIS. So just a note here, the only time that you're going to inactivate patients is if they're no longer being seen at your clinic. So other than that, you're going to keep all patients that you are currently offering services to active. So what this helps do is it helps improve immunization rates, because if you do have anybody that should be inactivated in ASIIS, then it's going to look like they're not receiving vaccines when they're probably just not being seen at your facility, which is actually going to lower your coverage rates. So how you're going to do this is you're going to first get into ASIIS, log in, and once you do, you would go onto the left side here where you have this menu with a bunch of drop-down options, and you would select patient and then click search ad. So what you're going to do is you're going to see a screen that looks like this, and you're going to type the first name and the last name of the patient and the birth date if you know it. And then once you hit search, it's going to come up with every patient that's listed under your organization. And you'll look for the correct birth date and patient ID and select the correct patient from there. And then once you have selected the correct patient, it's going to show up this patient demographic master view, which is going to give you a list of some information about that patient, including their status. So what you would do is down at the bottom of the screen, you would click the edit button. And how this is going to look is it's going to give you the option to change some of these statuses. So one of the things that you're going to want to do is go to patient status, and under organization level, you would select this drop-down menu and just select the reason for the inactivation. And then you're going to want to make sure that you go to the bottom of the screen and hit save again, and then double check. And then now your patient should be inactive and their organization level will change in ASIIS. If for whatever reason you do get a patient who comes back to your clinic, as soon as you start administering vaccines again, or if you wanted to go in and edit their status, you're more than welcome to do so. And you would just do the exact same process, but make them active. Okay. And then the next report I'm going to show you guys how to do is the reminder recall. So the reminder recall report is basically used for creating a report based on different criteria that's going to actually be able to identify patients in your population who need a certain series or a certain vaccine. And this is really going to be helpful for locating any patients who are maybe missing vaccines that you want to prioritize scheduling to keep everybody on time with their routine vaccinations. So how you're going to do this is same way that you would do the inactivation. You would just scroll to this menu and you're going to locate reminder recall on the left-hand side. And then in the drop-down, you would just select reminder recall. And it's going to pop up with a report like this. And there's some couple things that you're going to want to manipulate. So we'll go over those. The first thing is how you want to run this reminder recall. So it's going to default to for all patients you own, and you can keep that. And then the due date time frame can really be up to you guys. So it's going to default to due now, but if you wanted to run the report for anybody who may be missing vaccines, who's past due for them, or if you wanted to get ahead on scheduling, you can also schedule it for patients who are due in a couple of months if you wanted to get them scheduled when they'll be ready to come in. But due down time frame is also perfect. The state level and county level status, you guys can run that all active with inactive organizational level status, or all unknown, and that's really just depends on how you want to run it. Okay, so next is who do you want to contact? So this is where you guys are going to have to decide what the right criteria is for you. The patient location and all of this information is going to auto-populate based on your PIN, so you can leave that. And then the age range, you guys again can manipulate this to whatever population that you are trying to contact. Again, for the cloud awards, it is going to be that 24 to 35 month range for the pediatric patients, and then 13 to 15 for the adolescent population, which is a really great place to start, especially if you're getting ready to submit for your cloud awards. But as you can see here, there's 11 to 18 years. So you guys can really manipulate that however it makes sense to you. And then if you did want to run it by birth date, you can do that as well. And we do have a tool for calculating those birth dates if you needed that. So basically you would just input here the months or the year age range that you wanted to do. And then on this page, it's going to ask you which vaccines you want to include. So there's a drop-down menu where you have a bunch of options. So again, for the pediatric population, it's going to be that 431-3314 series. And then for the adolescents, it's that Tdap, MCV, and HPV. You can also customize this report if you wanted to select specific vaccines that you wanted to run the report for. And I just wanted to note that you will see the 3 listed, but it also includes patients who are up to date doing the 2-dose series. And then down here at the bottom, you're going to select due for all selected vaccines, and then you would generate the patient list. It's going to ask you what you want to do with this list that you get. So you'll get kind of a page that looks a little bit like this, and it's going to have a list of all the patients that are included due for vaccines based on what you selected. And then it's also going to show you the age of the patient, which vaccines are due, and the contact methods that you have available in ASIIS for them. It's going to highlight with these icons. So some available contact methods are home address, phone number, and email, things like that. You also have the option to inactivate patients if you notice, or if you run the report, let's say you contact them and they let you know we're actually no longer coming to this clinic, you can go ahead and inactivate them from there as well. So if you wanted to, you could submit this list. And then as you can see here, this is going to pop up with some icons that indicate a couple of things about the population that you just pulled from this report. So this number is going to tell you the total number of patients in this. And then it's going to tell you how many home addresses, how many phone numbers, cell phone numbers, and email addresses that you have. Some of the different options that you have in ASIIS are printing letters or sending emails to contact them, and these will pop up with kind of like a template that you can manipulate if you wanted to. You can also call them, you can do postcards, anything that you guys really want to do to contact these. But one thing that I find really helpful is generating patient list. So you would select this, and then it's going to pop up like this, and it's going to tell you how to run it. So you'll just hit run down here, and then it's going to show something like this. So it's going to give you every patient that you selected for this report, which vaccines do, which doses do, and then the recommended date. And then obviously this demographic information will be filled in for you guys to locate them and be able to contact them. Okay, and then the adolescent one looks very similar. It's just going to show you any doses of which vaccines they need and the recommended date for when they need those. Okay, and if you guys do have any questions, I'm happy to answer those at the end as well. And then the last report I'm going to show you guys how to do is your coverage rate report, which again is what you're going to be using for the cloud awards. So when you go into ASIIS, you're gonna, on the left-hand side, click on this reports, and then you'll go down to the drop-down and select report module. It's gonna pop up with a bunch of different options for you, and underneath registry, you'll just select coverage rate report. It's gonna pop up with a window like this, and it's gonna default to run it by ownership. You're gonna keep that way. For this part, it's very similar to the reminder recall. So you'll select the series from the drop-down menu. Again, for the toddlers, it's that 4313314 series, and then the adolescents is that one these have MCV and the up-to-date HPV. Once you've selected the correct series, you'll go down and manipulate the age range. Once again, for the TAPI awards, it's the 24 to 35 months, and for the age range for the teens, it's the 13 years to 15 years old. So that's what you're going to want to input when you're running these reports. For the pediatric population, we can kind of get into a little bit more about this as well, but you'll see this just evaluate at date, and you'll want to make sure to put in 24 months because we are evaluating at the 2-year mark for those. All of these limit report by are going to auto-populate based on your PIN. And then you're going to, for down at the bottom, have this option here to select which display report columns that you're going to want to see, and it's going to be a little different for both of the reports, so we'll get into that as well. Some of the options you have down here are obviously creating that coverage rate report. From here, you can also run a patient list, which is exactly the same as the one you do for the reminder recall. And one thing that I love and I find very helpful is that you can export all of this information into an Excel sheet as well, which can be really helpful when you're trying to use the data, especially if you're contacting patients. Okay, so like I said, for the toddlers, you're going to run it by this 4313314 series, type in the correct age range that you want, and making sure you're selecting that evaluate at range as well. And then for this display report columns, you're going to select everything except for the 1 dose and the 1 visit to complete. So you're going to want to see complete by vaccine, the incomplete series, the not yet due late by age, and the missed opportunities. And then what you'll do is down at the bottom, you'll select create coverage rate report. It's going to show up with something a little bit like this. You can just find it down here for you guys. So this is all going to be information about your PIN and your facility and kind of the different vaccines within the series that were selected, and then which age range. So you can double check there and make sure that you have everything correct. On the left-hand side, this is going to be the total of patients that you have within that 24 to 35 month age range. It's also going to break down completion by each vaccine within the series for you here. So that's going to be these total numbers and percentages. And then this is going to be the number of patients who are incomplete or missing those immunizations in ASIIS. This not yet due column is going to be the number of patients who are up to date by 24 months of age. The not yet due late by age is the percentage of patients who are up to date, but after that 24-month mark. And then obviously pretty self-explanatory, you have those missed opportunities, anyone with a missed opportunity to vaccinate. And then on the right-hand side, it's going to show you the series complete through 35 months of age, since we are looking at a different age range here. For the adolescents, again, you'll select that Tdap, MCV, and HPV series. And then for the cloud awards, you're going to want to make sure to select the 13 years to the 15 years age mark. And then the display report columns are also going to be a little different. So you're only going to be looking at the complete by vaccine, the incomplete series, and those missed opportunities. And then same thing, you'll select create coverage rate report. Information in terms of what the report looks like is very similar. You'll just see less display report columns since you only selected 3 this time. So it's going to show your total patients, again, the completion by vaccine for each one. And then it's just going to show you the incomplete series. So again, those number of patients who are incomplete or missing those immunizations, any missed opportunities in ASIIS to vaccinate, and then the completed series all the way through. And again, as I explained before, you can also run the patient list for this, which is very similar to what you can get from the reminder recall. You're just going to want to make sure to select this box that says exclude patients who have either no forecast or aged out, just so it's going to make sure that all that information is as accurate as possible for you guys. And you will either create the patient list or export it if you wanted to use the data in an Excel sheet as well. And again, this is going to be very similar to the reminder recall. It's going to give you the patient, all the demographics here needed, the vaccine name, the dose that they need, and the recommended date for when they need this. And as you can see, this date highlighted in blue is the recommended date for when they need their vaccines, letting you know that it's coming up pretty soon. Just a reminder here to go ahead and inactivate any patients who aren't being seen in your facility, and making sure all that data in ASIIS is updated, just to make sure you're getting the most accurate data when you do go ahead and run these coverage rate reports. Okay. And that is everything I have for you guys. So thank you so much for your attention, and I will be here at the end if you guys do have questions.
Thank you so much. That was great. And just so everyone remembers, we do have the sample reports and instructions, all of that available on our website. Does anyone have any questions for Pilar? Feel free to unmute and go ahead and ask her. And then just as a reminder, when we receive these reports at TAPI, we want to make sure that you don't have any patient data on there. Make sure that you don't send us all of your patient information, all 300 of them, and addresses and names, all of that. We don't want to see that. We just want to see the finalized report that shows the percentages, how many patients you have, all of that. So keep all of your health information private. Thank you. Okay, Paloma would like the support line phone number. Pilar, would you mind typing that in to the chat? That would be great. Any other questions? Okay, here's another question. Okay. Alita, do you have a question, or you would also like that support line phone number?
Yes, I do have a question regarding the ASIS report. Our organization has several PIN numbers, and my question is, like, when we're trying to run this report, would the ownership of patient will affect this report? Just because when I try to run them on ASIS, I'm not able to edit the clinic by PIN number. It only gives me the organization. So I don't know if there's something like on the ASIS or
So is the reason you have several PIN numbers because you have several locations?
yes. And I was trying to separate them for the Daniel like cloud just to run it by clinic, but because if a patient comes to one clinic, it automatically owns that patient like by ASIS. So I don't know if there's something that I can do on our end, like for ASIS not automatically claim ownership of those patients, because I believe at the end it will affect the reports on the separate level.
Pilar, do you have any ideas of how to address that? Or Eileen, can you help with that as well?
I believe it would depend on what your status level is in ASIS in terms of your account, what you have access to. You may be able to have access to each PIN number, and it's just going to depend on your login, how you'd be able to run those. Also, if you do have any patients who are floating between facilities, then they may show up as active on all the reports that you're running. But if you are trying to run a report for each clinic that you are part of, then you should be able to in ASIS depending on your access within your ASIS account.
Okay. So if you could put the helpline number in the chat, and then she can ask if, try to run it by each PIN number. And then if you have any questions or issues about making sure those patients are assigned to the correct location, the ASIS help desk is great. They can help you out and answer any questions that you have.
So I think I have something similar. I am assigned to one PIN. We have several clinics. Each clinic has their PIN. But I wanted to run the report for a clinic that don't currently have access to ASIS through. Am I able to be assigned multiple PINs?
Again, I think you would have to go through.
Go ahead.
Go ahead, Amy.
So you could be assigned multiple pins, but the only thing you would have, you would need a different login for each pin. So like a different email, and you would be, you could have that access, but with another login, basically, like a new account, but you would just have to request that. In other instances, you can also have your primary or backup coordinator or your office manager for that specific location run the report and just forward the report to you. That way it's less, you're not confusing the pins or logging into the wrong one. So they should have also access to run this report as well.
Okay, thank you.
You're welcome.
And we do want you to submit for multiple multiple locations within your practice. Every year we have several different mountain park locations and they all submit separately. We have a lot of multiple practices submitting by location. So it is definitely worth running those reports, checking your numbers, calling patients in, trying to get them caught up if your number is not quite as high as it needs to be. It's definitely worth the effort and such a great thing to celebrate all of that hard work. Any other questions about ASIS? Okay. Please feel free to use the chat. We would really love to answer any questions. And we do have a spot at the end for live questions as well. So I wanted to go over some important dates for the Cloud Awards. Cloud Awards open today. So this morning, we sent an email that the awards are open, all of the nomination links, those are all open, and we already got our very first report submission. So thumbs up to that practice that already submitted. That's wonderful. The first report due is Thursday, February 15th. So you have a few weeks to get that first report in. And then on Thursday, March 14th, the nomination period closes and any final reports are due. Now, if your first report that you submit by February 15th, if that shows that you have fulfilled the assessment, the percentage, and you are an award winner, there is no need to submit a final report. But if your percentage is not high enough and you do want to try to call patients in, clean up your data, anything like that, that final report is due on Thursday, March 14th. New this year, we're going to post updates to nomination status on Thursdays by 5 p.m. And there's a link here of where that will be. All of these links were in the email that was sent to you today, so you should have access to that, or it is available on our website. So you'll be able to easily go to our website and see a list of winners or need a second report or whatever on our webpage. And then our TAPI award ceremony is Tuesday, April 23rd from 5 to 8 p.m. And I will tell you a little bit more about that in just a minute. Let's see, and just looking at the chat real quick. Oh, good. Mountain Park is here. Yes. Lots of celebration. Mountain Park has been an award winner for over 20 years, as well as some of our other practices. And, you know, each year we actually have a lot of brand new cloud winners that have never heard of the Cloud Awards, or they've been working towards that for several years. So we love to honor brand new practices as well as repeat cloud winners. It's very fun for us. Okay, so Sherry typed in, she has several locations as well, and she's able to run each individual one. Oh, excellent. By selecting the view by tab and selecting facility, and a drop down will show you and give you the option of each facility you have access to, and then you run them individually. So that sounds very helpful, Sherry. If you have multiple pins, that's how you can do that. One additional thing about the Cloud Awards, it's very important to make sure that your reports are correct. We do go through and double check all of them, make sure that things have been run correctly. So make sure they're correct before you are submitting them. And just as a final reminder about the Cloud Awards, the toddler series is 4 DTaP, 3 polio, 1 MMR, 3 Hib, 3 hepatitis B, 1 varicella, and 4 PCV. So you heard Pilar say 4, 3, 1, 3, 3, 1, 4. I got to memorize that, but that's what all of that means, is those specific vaccines. And then your teen series is 1 Tdap, 1 MCV, and being up to date on HPV, whether that is the 2 or 3 doses needed to complete those series. And then the age ranges are listed there as well. This chart is on our website and also was in that email that we sent today. Any questions about the vaccine series assessment or anything about that? Does that make sense to everybody? And if you have any questions, we do have the sample reports with the step-by-step instructions that we went through. We have that all available on the Cloud webpage on our website. Okay, so the other award that we honor at the night of the award ceremony is the Big Shots of Arizona Award. So that is exceptional efforts in the field of immunization, trying to improve coverage levels statewide. Those nominations are open on February 6th, so you have just about a week or so before the nominations open. So this is for individuals or organizations, and it's not assessment based. So we look a lot at what interesting things people are doing in the communities around the state to improve immunization levels, what creative ways or what years of hard work. It really is dependent on what is going on and what is happening. So I wanted to just kind of go over a few from last year. Last year, we honored a fire department for their longstanding work with the Baby Shots program. So that is where they go out into the community and they are giving, catching up kids on their shots as much as possible, maybe kids that aren't making it into your practices. It's really great to have a partnership with the fire department to get those kids caught up. We had a medical assistant who revamped her practice vaccine system. So she took it on herself to kind of figure out what was working, what was not working, and how her practice could kind of build a really great immunization system. So she assessed at different locations in her practice, went to extra trainings, tried everything she could to improve their immunization rates, and she really did make such a huge difference. So we love those medical assistants. Another one was not a vaccine practice. It was a dialysis practice who really wanted to focus on making sure that all of their dialysis patients received their COVID vaccines. And so they started offering that in their practice. It's kind of an unusual way to get a COVID vaccine when you're used to getting your vaccines at other places, but they really wanted to focus on protecting their patients. And so they were able to achieve 100% coverage for COVID vaccines for their dialysis patients. So that was just a few examples, but we have a lot of different award winners over the years. So kind of look around yourself and see what's going on in your different communities and practices and what people are doing that is kind of outside the box, and make sure to submit a nomination form. You can nominate yourself or your practice or anyone else. So it's based on individuals and organizations. Any questions about the big shots before I talk about important dates? Feel free to chat it in or unmute. So important dates for the big shots. They open Tuesday, February 6th, and they close Tuesday, February 27th. So you have just 3 weeks to get your nomination in. That requires, information about the nominee, what they've been doing, and a short write-up of explaining how they have made a difference in Arizona. So make sure to do that. And then winner announcements will be emailed to the nominator on March 12th. Sometimes people like to have it be a surprise. And so then they just invite their person that is the winner to the award ceremony, and it's a surprise at that time. Sometimes they like to tell the person they've nominated beforehand and then get them excited about coming. So that's really kind of up to you. We do email who has nominated that winner. And then once again, the award ceremony is on April 23rd. That is in conjunction with the state immunization conference. So if you are coming for that, please stay and come for the award ceremony as well. Okay, what questions do you have? Is there anything we haven't answered? Anything about the Big Shot Awards or the Cloud Awards or ASIIS, anything like that? Paloma, if you want to type in any questions, feel free. Says your microphone is not working. We will post these slides on our website as well if anyone wants to review it and the recording of today. Any other questions? Okay, well, let me talk about the award ceremony for just a minute. If you are familiar with the award ceremony, you kind of know that it's a big deal. Everyone gets to come and celebrate with other vaccine champions. It's really fun to be in that room with 300 to 400 people where everyone just loves vaccines, and we're all happy to be celebrating all of the hard work that goes into keeping our state immunized. So it's a really cool feeling to kind of be there together, rubbing shoulders with all of the other people who are working as hard as you are to get those people immunized, keep those kids healthy. This year we will be going to the DoubleTree by Hilton Phoenix Mesa location that is located in Mesa, just off the freeway, the 60. And it's from 5 to 8 p.m. We will be honoring both the Cloud and Big Shot Award winners. We have a fun program planned. We have a delicious dinner planned. The last few years, we've kind of done like appetizers and drinks. And this year we are going back to a full dinner with delicious food. We did a taste test and it was amazing. So there's your choice of salmon or steak and delicious side dishes. There's options for vegetarians, drinks, all kinds of things, desserts. It'll be very fun. So just a reminder that those Cloud Awards open today, and then the Big Shot Awards open February 6th. And Laura just put in the chat the link to the Cloud information. On that page, you can also link to the Big Shot information as well. And that is it for our presentation today. Does anyone have any last questions? Feel free to email this awards email, and there's a few of us on the team that can respond to you. We get lots of emails about, specific things or issues with running the report or any questions about the awards at all. So we're happy to answer those, and I'm happy to take any last questions. Thank you again to ADHS, Pilar, and Eileen for helping today. You guys are the experts at those ASIIS reports, so I appreciate that so much. And I think that is it. So have a great day, everyone. We cannot wait to see your nominations come in and hopefully see you at the award ceremony in April. Have a great day.